Hey everyone, thanks for joining me today. My name is Amy Derksen, and I'm a naturopathic doctor in Seattle, Washington. And I'm presenting this video today with a PowerPoint as a follow-up to an interview I just did with Biocide and Botanicals, talking about GLP-1s and other peptides and things that I'm using in practice. And as I was preparing for the interview, I realized there's so much information that would be great to share, and it just gets lost. And the interview was also just for practitioners. And so I wanted to have an informative way of sharing some of this information that'd be useful for you if you're a practitioner, or also if you're a patient and maybe you've been trying some of these things, thinking about some of these things, or wondering if you should ask your doctor about them. So I hope you learn a little something. And I'm sharing some of the things I'm actually the most passionate about in practice right now. So my background, I've been working with autism, allergies, chronic illness, Lyme disease, long COVID, autoimmunity, all the outside the box things since I started in practice in 2003. So it's been 22 years, which I can't even believe. I was fortunate enough to start right out of Bastyr with Dr. Dietrich Klinghardt. So I was his first naturopath. He decided he wanted to take a doctor under his wing at the time and kind of let me learn all of his tricks and set me free then to help treat others. And it was an amazing experience from the beginning, honestly, really learning how to view every patient in a similar way, right? It doesn't matter what your diagnosis is. We're all similar. It's just a different presentation. It's how are we taking in all of this impact of all this toxicity in our environment, all these infections, all of these other things, and that inflammatory cycles that it can create for some of us. Some of us go autoimmune, some go cancer. Um, my specialty has really been working with autism, but also I have a passion of working with some of my adults who've really been struggling for a long time. So many physicians over the years will refer to me when they feel stuck or when maybe their Lyme patient is ready to be off antibiotics or wasn't doing well with their antibiotic treatments. And now we're trying to get back to living a better quality of life or figuring out how come you didn't respond to the treatments that all the functional medicine doctors and the biomedical doctors know about, but how come you're the one who feels like the only person outside the box? Well, that's kind of my area of expertise, or at least my area of like always questioning and diving in, and the thing that's really kept me going for the last 22 years. So my background was in biochemistry, but I use the system that I learned from Dr. Klinghardt called autonomic response testing, which is a form of kinesiology, essentially to test the autonomic nervous system or the nervous system against what might be stressing you. So I screen for bugs and toxins and inflammatory things and mold mycotoxins and all the things to get an idea of what's primary. Personally, I've dealt with some autoimmune issues. Long COVID really did me in. So had, years of Hashimoto's, and then, man, my immune system went a little bit bonkers. It's been a scary ride. I was a competitive athlete all through college, actually did quite well, was training for a triathlon when COVID hit, and it has done a number both on me mentally, which I've recovered from, but also physically, tearing a bunch of muscle since then and having all kinds of weird mitochondrial sort of things and these inflammatory flares that I'm still trying to figure out, getting a handle on, and then trying to apply what I've learned from my patients and what I've learned on myself to help my patients. So what we learned from our chronic Lyme, mold, COVID, PANDAS patients is there's an initial trigger or an initial set of triggers that just cascade: strep, candida, mold, Lyme, Bartonella, Babesia, COVID, Epstein-Barr, you name it, heavy metals, all kinds of things. We get an immune system response, so our immune system gets triggered. It often stays in this Th2 dominance, so more that allergy, autoimmune type response, and less of that Th1 kind of effective, fight off the infection and move on with your life sort of phase. So at that place, so once someone's been stuck in that, the cup pretty much spills over. I feel like, we've had this load that's hit us, and now any little thing can set you over. And you feel, for some people who walk in my door, like anything can set you off. Foods that were safe before now seem to trigger you. You go into a place that just wiped down the counters with bleach, that can set you off for a few days. It's not those individual triggers that keep coming at us that are the problem. It's that our overall load is so full and we're so reactive that we need to figure out a way to help calm that down. And that's where a lot of these treatments that I'm talking about today come into play. So lots of pathways can lead to the same set of symptoms. I'll get my picture out of the way in case it's on your screen there. We'll put me over here. Cytokine storms, mast cells, histamine, biotoxins, microbial load, heavy metals. There can be active infection. There can be oxidative stress, which is really a big one that we're seeing post-COVID. It's damaging the mitochondria, setting off this inflammatory cascade. Methylation concerns. A lot of you have heard about the MTHFR issue with folate, or a lot of you working with autism have done the B12 shots or find these huge deficiencies. Methylation concerns are a big one and often lead to poor DNA repair, fatigue. I don't know, you get depleted, and it's a huge factor in helping with our energy and our adrenal function. The Th1 Th2 imbalance that I talked about, neuroinflammation, immune suppression, adrenal and thyroid dysregulation, you name it, it's kind of a mix, and it can look a little bit different for everyone. So some simple and effective treatments to help with this immune dysregulation and inflammation that I will talk about today. Vitamin D, the GLP-1s. So what in the heck are GLP-1s? We'll get into that, but semaglutide, tirzepatide, so pretty much low-dose Ozempic. You've all heard about that for weight loss. Well, I'm going to talk about some of the other benefits that you can get with that just to help with neuroinflammation and cognitive function and hormone function and insulin receptors. Some senolytic peptides, TA1 and TB4. So some of our thymus-derived peptides to boost the immune system and calm down inflammation. These things are game changers. Gut support. I wouldn't be a good naturopath if I didn't talk about the gut and maybe a little bit about poop. So there's gut support and there's some repair peptides related to that. So we'll definitely get into that. And low-dose naltrexone, not a peptide, but an off-label use for a prescription med that has been a real go-to for me for many, many years that can help to reset that immune system. So why do we care about vitamin D? I mean, it seems obvious. Oh, you get some sun, you'll be fine. Well, I live in Seattle and I'm pretty sure we don't get enough sun here ever to get vitamin D. I think they said you have to be out in the sun between April and maybe August or September, and there's only like a 1 or 2 hour window during the day, and you'd have to be naked. So I'm not really getting out there naked during the day to get enough vitamin D. And I definitely have seen most of my patients, regardless if they live in a sunny area or not, are not getting enough vitamin D. Vitamin D is so important for immune function. I mean, there was even a study in Brazil years ago how boosting vitamin D levels was more effective than the flu vaccine for helping the immune system. So vitamin D improves body functions, great for long-term health. We like these lower daily doses to help replenish things. I do high dose pulses, which I'll get into here in just a minute, for immune reactions and flares. Vitamin D can lower complications. It definitely helps hormones work better. So for any of you doing HRT therapy, you definitely want to make sure someone's vitamin D levels are adequate. And recommendations for vitamin D, even in all of the pediatric groups, to start with infants on some vitamin D. So serum levels that we're aiming for, it's going to be somewhere between 60 and 80. If you're working with cancer, you probably want to go higher. Possible risk if you get your vitamin D levels too high is triggering parathyroid and getting that calcium level up. So the nice thing is if you're pushing these higher doses, in my experience, it's been the rare patient that they'll have that response, maybe 1 in 200, where their serum vitamin D will shoot up, but their calcium will too. And what they notice is kind of a tighter feeling in their tissue. Unusual, you're going to see it pretty soon. So what I would say is if you're pushing high doses, maybe 2 months after doing that, go ahead and repeat. I don't know that you need to repeat a vitamin D level, but you definitely want to repeat a chem panel to include that serum calcium to make sure it hasn't shot up. If you're repeating a vitamin D, my tip on that is vitamin D is a hormone state and it's fat soluble, right? So it stays in the body. You want to take probably a 5-day break from any oral dosing before you do a lab test. Otherwise, it'll look falsely elevated. So dosing for most adults that I'm finding is about 10,000 a day. Here in the Northwest during the winter months, I'm doing 20,000 units a day. Definitely balancing with some vitamin K2. And there's some great products out there, Metagenics being one of them, that includes some K2 along with a vitamin D in the same pill. So it's not one other supplement you need to buy. K2 helps direct the calcium into the bones and into the teeth where it needs to be. Most children are needing about 4,000 units a day. And then this flare exposure that I talked to you about is if you're first coming down with a sickness Or a lot of times we're doing low dose immunotherapy, so LDI therapy for allergies. So if someone flares in that treatment, or let's say you've started a new treatment with someone and it feels like they're having a histamine response, you can do this big dose of vitamin D, which is 50,000 or even 100,000 for 3 days in a row. I put that on there wrong. So it's 50,000 twice a day for 3 days. I've gone as high as 100,000 twice a day for 3 days. In children, I will do about 25,000 twice a day for 3 days. Easy way to do that is with drops. And a lot of the common companies, Mountain State Health and Thorne, offer pretty flavorless drops in MCT oil. So vitamin D can mimic that effect of giving a steroid to calm things down without suppressing the immune function. And it can really, really, really help. Now let's talk about GLP-1s, because that's why you're probably here and why you're even interested in this. So my experience is mainly with semaglutide, so that's what I will refer to. So that is our low dose of Ozempic. So Ozempic is semaglutide. It's a protein secreted by the endocrine cells in response to oral fats and carbs. It's used in diabetes and obesity. It decreases pro-inflammatory IL-6 and TNF alpha. So what that means is it reduces inflammation. It's a growth factor for brain cell repair. And what I'm hearing from a lot of people, including I put myself on this, is brain is just working a little bit better. Less of that background anxiety and noise, and just you feel a little more present and able to focus and get things done. And it also improves brain mitochondrial regulation. So really good because we're seeing a lot of oxidative stress and mitochondrial damage. So we're seeing a lot of benefits with this other than just the weight loss, which is what everyone talks about. So semaglutide typically given as an injection. There are some compounding pharmacies who've come out with sublingual preparations of this. And then there's like oral Wegovy, which is also a pill. In my experience, the injections work best, but I haven't been using the sublingual liposomal preparations yet enough to know if they match up. I have a couple patients where they've chosen to start that. So it's just a little tiny subcutaneous injection, actually really comfortable injection to do. So it's just a little insulin syringe. You do a pinch of belly fat, or you can do the hip or the arm. There's some higher doses, and I'll do a comparison slide here in a minute, just so you would know what we're doing if they're doing prescription Ozempic. A tip on that one is Ozempic is only covered by insurance if the doctor puts type 2 diabetes. And so if they don't technically have type 2 diabetes, we really can't get coverage for that. But the compounded lower doses, or even if you're matching those high doses, but with a compound that's not that name brand and not in that fancy auto injector, so much less expensive. So you can usually get this from a pharmacy, I would say, even on my end. So I'm doing it as a patient, not getting a special price. I think mine is costing me about probably $45 to $50 a month, because shipping gets a little bit expensive, maybe even less than that. So very, very doable. Multiple pharmacies have been doing this. It's still available. Tirzepatide, which is the other one that has a little bit longer effect and some other benefits that some other people are seeing, is harder to get right now in the US, which is why I'm not going to talk about it that much. But during that interview, we talked about it. Probably best on semaglutide if you're doing these low doses to cycle on and off to avoid receptor saturation. So one of the things that we're seeing with these higher doses of Ozempic that have been just kind of given to everyone, everyone's talking about all the people in Hollywood are getting all skinny, but they're getting these little pancake butts. And can you ever come off it? The problem is they're doing these really high doses from the get-go, and you're saturating these receptors and needing more and more to respond. And then the question is, what happens when you need to come off? And so what we're finding is with these really low doses is you'll get to a point, usually around 2.5, 3 months in, where you'll feel the appetite suppression is lasting longer than a week, or you just feel like you don't quite need as high of a dose. It's a funny feel, but you can sense that that's going on. And at that point, a lot of times you'll notice the weight loss really starts, but you can also then take a week off here or there or start to spread out some doses. And so we can really play with staying in this really safe dose range without needing to go higher and higher and higher. And we have a good exit strategy, right? It's not like you're going to go off and all of a sudden all the weight comes back on and all the problems happen. So I think it's probably best to cycle on and off. I would say after 3 to 6 months, depending on the person and really what they're going for, you may want to take a week or two off, or even a little bit longer. One thing that we're playing with in our office, we're all just trying to figure this out and see what works best for people, is maybe at the 3-month mark, I'm skipping a week a month, or I'm just starting to spread those injections out maybe every 10 days rather than every 7. So it's approved in the US for ages 12 and over, and this would go for the regular pharmacy prescription Ozempic if they have an elevated glucose that's technically type 2 diabetes, or a BMI, I believe, over 30. So there's a slide in here and you'll have this, so I don't need to go through that, but conventional Ozempic doses versus these low dose compounded doses. And to do the compounds, typically they're mixing that with B12. It's how they're able to compound that. Unfortunately, most use cyanocobalamin rather than methylcobalamin, but I haven't seen any issues with that. And everyone needs a little B12 anyway, so it's not going to hurt anything. It just makes it really red. So conventional dosing starts at 0.25 milligrams and goes up pretty quick to 2 milligrams every week, where our low doses, we're starting with 0.1 and inching our way up. I've been on it now for, since September, so about 4 months, and I'm at 0.15 and it feels a little high. So I'm actually at the point where I'm taking a break. Every few weeks, I'm taking a break and starting to back off because I just don't need it. I've sort of lost the appetite. I've lost some weight. It feels like it just kind of kicked in my metabolism to where it was when I was younger. And really what I'm seeing, and we'll get into this a little bit, is who benefits from this when it comes to weight loss. And definitely if you have that high insulin, a lot of chronic patients, you might have noticed yourself, if you're not a practitioner, that your doctor has run your labs and maybe your hemoglobin A1C is running a little bit high. And you're like, why in the world? I have a really clean diet. I don't eat sugar at all. What's going on? But it can be a sign of some inflammation. And sometimes we'll also see that the insulin levels will be a little weird, either really low or really high. I've seen it really helping with that. And I've definitely seen it for my perimenopausal women, where your body just decides it wants to change and put soft tissue where you don't want it anymore. You don't want a little bit of a belly. You don't want these arms to feel a little bit saggy. And it feels like you really just can't lose the weight like you used to. And I've really seen that jumpstart things and help. So all of a sudden you're doing your exercise and things like you used to, and your metabolism is responding. So GLP-1 injections, definitely more than just weight loss. It decreases immune-related inflammation. So I talked about that IL-6 and TNF-alpha, assists with brain cell repair and improvement, helps improve brain mitochondrial regulation, helps with those ruminating thoughts, those repetitive things that are going over, or even that background agitation. It can help with that. It can be used in PCOS and fertility treatments, where we see some of that weird blood sugar related stuff that really isn't related to diet. Helps with cognition. It can treat depression, helps to regulate the immune system, reduces alcohol addiction is another thing that can help. So some benefits with weight loss, pretty similar on these low dose compounds, maybe a little bit slower to kick in. What I've noticed with most people is they're losing inches around the waist before the pounds on the scale really reflect that. So a lot of people are losing 5 pounds that first week, maybe first 2 weeks, but then they're noticing their belts fitting a little bit looser, pants fit a little bit easier. And then around that 2 to 2.5 months in is really where we see some numbers on the scale change. Like for me personally, it's just been slow and steady. And like I said, it kicked my metabolism into where it used to be. So it was nothing dramatic. No weird blood sugar things. I actually tend towards being hypoglycemic. So it was interesting. I experiment on myself on everything before I try it with my patients. And if anything, it's normalized blood sugar issues for me, which I thought was great. And it's not about just eating less calories. One of my thoughts when getting into this is I was afraid of some of the side effects they talked about, but I was just like, hey, is this just calorie restriction? Is that why people are losing weight? And it really isn't just about that. Yes, it will help you eat less. You'll crave sugar less for sure. But it is changing those insulin receptors, and it's changing the leptin levels. So we're just tending to not store fat like we used to. I talked about the benefits already, so this is just a different version of that. A few things I really want to emphasize is there are some things you must do if you're on GLP-1s. Absolutely positively. Like I won't start someone on this unless they agree to do this. You have to do weight training, because the last thing you want is, if you're losing weight, is that you're losing muscle. And the tendency on the GLP-1s, on Ozempic, semaglutide, tirzepatide, is you are going to lose muscle mass, especially in your rear end and your thighs. And so weight training, if nothing else, I want you doing some lunges and some squats. If you are at a point, maybe you have some knee issues or some other issues, I'm having people go back and talk to their physical therapist or to work with a trainer. But I think our physical therapists are really great for that if you've been dealing with an injury, or maybe you have osteoarthritis or some hip degeneration. I think it's really good to talk to someone very specifically about what exercises are appropriate for you. This can be easy. It doesn't mean going to the gym. It could be as you're out on your walk, incorporate some stairs and really think about lifting through the thighs and through the back. If you're doing some exercise bike, one thing I play with on mine is I just turn up the resistance periodically while I'm on the bike and just really think about going very slow and pushing through. So I'm really getting that resistance training. So we highly suggest strength training 3 to 4 days a week for 20 to 40 minutes. I would start that from the beginning. You need that to maintain that muscle mass. And also, so there's not that rebound when you get off this at some point that we're penalizing you in some way that your metabolism isn't as good as it used to be. You have to also eat enough protein. And this one is probably the toughest thing because your appetite is down. And especially when you first get started, or what you'll notice is the day or two after an injection, you are not hungry at all. And something heavy, fat and protein just doesn't sound good. So you're aiming for 30 grams 3 times a day, a heck of a lot of protein, like the protein level of an athlete, right? It seems like a lot. That is about the equivalent of like a chicken breast the size of the palm of our hand 3 times a day. Hard to do when you're really not hungry. I have found that doing some collagen protein, so some collagen peptides can be great. A scoop gives you, I think, about 10 grams of protein, really easy to mix into your coffee or tea or liquids. Very easy to digest. So even if digestion feels a little slow and a little bit off, that can be a nice way to do that. I find that sets a lot easier than some of the heavier protein powders. So aim is about 1 gram of protein per kilogram of body weight or more. You want to clean up the diet. So less carbs, less sugar, definitely more water. Things are going to slow down and water is incredibly important, and definitely more protein. So some possible side effects on the GLP-1s, even on the low dose ones, is some reflux. It can kind of just slow down the digestive system. So we can see a lot of gas, like not stinky gas, but just gas. Things are slow. Headache, nausea, especially the day or two after an injection, some insomnia, maybe some dizziness. I don't see this very often in the low dose compounds. Sometimes we see it with dose changes. And a lot of times I think it's hydration and electrolytes related to that, or you're just not eating enough. So some tricks to reduce those side effects. Exercise is honestly one of the best things, and drinking enough water and eating enough protein. You can also take some digestive enzymes, something usually with DPP4, or an enzyme is going to be something that ends in ASE. So any, like even the gluten digest or Beano or lactate, those are all enzymes, but look for a broad spectrum digestive enzyme. And if you look on the back and it says DPP4, you've got a good one. And then supporting the gallbladder, and I'll get into some of those support things. And then eat more frequent small meals. Some people have combined this, and it makes it pretty easy when you're on a GLP-1 to combine this with intermittent fasting, where you're really eating, slowing down that eating window probably to 10 hours a day, and just doing hydration the rest of that time. So you can be smart and use this as a tool to help you do that. But within that window, eating the frequent small meals can definitely be helpful. And then work on digestive support. So now's a great time to tackle that longstanding Candida or SIBO issue, because you're putting in less junk as well. So sometimes our antimicrobials, this can be a really good time, especially for you as physicians, to let's tackle it all at one time. So 5 ways to support your gut health. Butyrate is one of my favorites. I just came off of 2 autism conferences focused on gut health, and butyrate was kind of the shining star. So naturally in our gut, helps our good bacteria thrive. It's stinky. Butyrate comes from butyric acid, which is rancid butter, right? So it's stinky. It smells like the supplement has gone bad. So if you don't know that, everyone kind of thinks it's gone bad. It doesn't have a bad taste. It will leave a little bit of smell on your hand, so you just don't want to touch it too much. But a lot of great butyrate products out there. And some of the gut support products actually combine that in there. You can do stool testing if you're wanting to tackle that longstanding gut issue. Stool testing can really take some of the guesswork out of that. Is this yeast? Is this bacterial overgrowth? Or maybe you just don't have enough of your good bacteria. Natural antimicrobials can be really helpful. Things like andrographis, cat's claw, berberine, especially berberine, which can help with the blood sugar as well, can be really helpful at this time. Um, Peptides, I'm going to get into that here. So some of my favorites specifically for the gut would be BPC 157 and KPV if you have more histamine related type issues with your gut. So a lot of food allergy type things. And then digestive enzymes like I talked about. So there's at the bottom there, that DPP4 is what you're looking for as the ingredient. Or if some of you are struggling, if you look on your labs and your calcium and protein tend to be low compared to your diet, then you're probably low in hydrochloric acid. So taking a hydrochloric acid supplement, or there's a good all-purpose one from Designs for Health called Digestzymes that has that DPP4 in there. It has your hydrochloric acid and even has a little bit of ox bile to help with bile flow in the gallbladder. So those can all be really helpful. So broken down in just a little bit different way for digestive support, butyrate, also helps to bind up ammonia, helps destroy some biofilms, really calming and soothing. So if you have a really sensitive, like ouchy sort of gut, butyrate can be really helpful. TUDCA and ox bile, really great for gallbladder and bile flow. So this tends to be compromised in a lot of my mold patients, or even my Lyme patients that aren't excreting a lot of those biotoxins, because a lot of those are fat soluble, which is why they go after our brain. And so our gallbladder, like an oversimplified version of that, is we have these toxins that our body's trying to get rid of. It goes through the liver, and then our gallbladder is trying to concentrate that, and then it puts it out into the digestive tract to help break down fat and protein, but also it's carrying a lot of those fat soluble toxins. So TUDCA is a plant substance that helps with bile flow, and then actually taking ox bile, which sounds pretty gross, but it's in a capsule form, can really help, for one, with fat and protein digestion, but especially fat digestion. So for any of you having that upper digestive kind of bloating fullness, you probably need some ox bile. Or if you're struggling with excreting those toxins, you're just not getting them out. A combination of the two could be really helpful. Digestive enzymes. The nice thing with digestive enzymes and why I harp on the DPP4 is, a lot of us are dealing with leaky gut, or there's kind of some gaps that our immune system is being really reactive to the foods we're eating. And the nice thing with the digestive enzyme like that is it's breaking down foods so small that antigens on them, or the little proteins on the food molecules, are now too small to trigger an immune response. So it can really be great if you don't know what you're reacting to food-wise and you're trying everything, adding a digestive enzyme with each meal. And I do this a lot with my autistic kids in my practice. Is there's some great chewables, or you can just open up the capsules and mix it in with a soft food, like a spoonful of yogurt or a spoonful of applesauce goes great if you're dairy free. And that can be really helpful to help just reduce those overall food reactions. Or if you shouldn't be eating gluten, but you can't help it, you're going to go have that pizza, just pop some digestive enzymes with that to at least reduce the distressed gut, but also reduce some of that inflammatory response after. And then oral immunoglobulins, IgGs and IgAs, like something like SBI Protect or prescription Interrogam, can be really helpful. You're looking for something with the product name brand Immunolin in there. These seems to be the good one. Otherwise, if you are dairy free, there's an egg derived product that Zymogen makes, this IG26DF. DF stands for dairy free, just to heal up leaky gut and help with that permeability. It also can help with immune function, right? Because we're sealing up that passage, nasal passages all the way through the gut. And that can really help with our immune system and keep us strong. So probiotics for those with immune or mast cell concerns, which is most people who tend to be pretty inflamed. Just taking any old probiotic, probably not tolerated in the way that you would hope, right? So if you are someone who's taken a probiotic and you're like, oh my gosh, this makes me feel worse, or you have given them to your patients, you're like, I don't know what to do. You need to stick with the more simple ones, right? Because when your immune system is so reactive, probiotics are bacteria, right? So if it's already primed to react to things, now we're just putting others in there that's going to trigger that response, just like some of these other infections would. So for those people who tend to flare or tend to have a lot of reactions, I like something like Lactobacillus rhamnosus. Bifidobacterium seems to be the one in all of the trends where they're talking about gut health. Is that where's the bifidus, right? The bifidus has been wiped out usually when we were young and set us up from a young age that we just don't have that diversity of our gut flora, and we're especially low in bifidus. Spore-based probiotics tend to be really well tolerated. Now, some of our mold patients might have to start really, really low. Um, I have been lucky enough to be able to go a little bit higher. Maybe a pill twice a day is kind of the sweet spot with dosing on some of these spore-based probiotics, but I tend to find that they're less triggering. One way that the spore-based probiotics were described to me before is they direct the choir of the gut immune system. So what you're putting in there isn't the thing you're really needing to populate. It's the thing that's telling everyone you get to grow and you probably shouldn't be there. And so it really helps to bring things back into balance. And I also find the sweet spot with that is dosing that for about 3 months. And then Saccharomyces, which is a yeast, but it's used like a probiotic. It's a specific yeast. And the way this was taught to me years ago is that it pretty much mows the lawn of our gut flora to help even out the playing field. And then you can follow it up to repopulate it with other bacteria or supporting it just with good fermented foods and some of those things. Saccharomyces is used also a lot in our mold patients who don't tolerate other binders or maybe are struggling to tolerate a lot of things because it can help regulate some of the reactions to molds. That being said, I've got to say Saccharomyces, because it is a yeast, some people who are really triggered by candida or mold or some of these things, it's all or none. It's either going to be really helpful or it's going to be really triggering, and there'll be no missing that it's triggering. You know, if it's your kiddo and you're giving it to them, it's going to be red cheeks, red ears, some hand flapping, probably within a half hour or 60 minutes of dosing it. A little less reactive like that with our adult patients, but they're probably going to feel a little bit triggered and they're going to know within a couple days, like, hey, this isn't feeling very good for me. So here's just a visual for that. Some of the specific products that I like. So you'll have these slides. The Seeking Health Probiotic Histamine X is nice for those with a lot of histamine issues. And allergy research, that Immunobiotic Pro is that Lactobacillus rhamnosus, which I like quite a bit. I should have this on there. Yeah, so Claire makes some nice bifidus. The spore-based probiotics, Biocidin makes one. Megaspore Biotic is another good one. Lots of good ones there. The Claire Therabiotic Detox Support, I like this one because there are no strep strains in there. So for some people dealing with PANDAS, sometimes we find different strep strains can be more triggering, and that one doesn't have it. And then Culturelle is another Lactobacillus rhamnosus. I really like it. And the nice thing with that is you can get it at any drugstore. So really good, especially for if you're dealing with Clostridia infections or acute diarrhea, or maybe you just had an IBS flare. Culturelle, because it's that immune modulator, has been really, really effective and well tolerated. And again, it's usually just one pill twice a day. So let's talk about peptides. So what are peptides, right? So they mimic natural processes in the body. They enhance or they replicate the body's own signals. So peptides are considered signaling molecules. And I'm actually going to jump ahead to this slide. So amino acids are the building blocks of proteins, right? They can line up in these chains, which form peptides, which are signaling molecules for the immune system, directing the immune system to do something. And each peptide is different. So you can't just say, oh, I do peptide therapy. That means, okay, I just do signaling molecules. There are so many. And this is really where medicine is going right now. I mean, there are peptides that are being used in cancer therapies because it can target particular tissues. And there are so many different things. So I'm going to talk about just a few of my favorites. And one thing that was taught to me really early when I started studying peptides years ago is that don't play with all of them, not from the beginning. You get to know one or two of them really well. You get to know how they do in your patient population, or if you're doing it for yourself, don't start 4 peptides at once. It's tempting, right? You read on these things, you're like, oh my gosh, I need all of these. Start one at a time because you're giving instructions for the body to do something. You need to give enough time for the body to do that and see what that feels like. So there's a few we'll talk about. BPC 157 and thymosin alpha 1 or TA1. Those are probably my 2 safe, go-tos to start with at the beginning, and then you can diversify and build from there. I'm going to go back here and see if there's anything else we need. The other advantage of peptides, so peptides are expensive. That's the downfall, right? Is these guys aren't cheap. It's probably $150 a month, maybe more per peptide, right? And sometimes they can only be given as injections, and not everyone wants to do that. But because they're signaling molecules, and a lot of them are signaling for repair, the effects are long lasting, right? So that the repair that you do while you're on that has really made a change. It's not a temporary anti-inflammatory band-aid that the second you're off, the process is still going on. This is changing the process, that whole inflammatory cycle that's happening with a lot of things. So I think it's worth the money. It can really turn some things around. But that's really how they differ from some of these other supplements. So some of my favorites, BPC 157 body protection compound, probably one of the best for repair. So just think repair, repair, repair. BPC 157 used in athletes is kind of where it started in some of these competitive athletes. And one of the benefits they noticed is they were able to train more intensely. They weren't getting injuries, or if they had an injury, injuries were healing up really quick. And one thing I noticed when I first started BPC 157 injections is I had this horrible Achilles tendonitis, and, moments of desperation when you're injecting your Achilles because you have a long distance race that you kind of signed up with friends and you're like, oh, what am I going to do? I can barely walk. A couple injections near my Achilles, which you don't need to do, worked like magic. And I was able to do an 8-mile run after really not a lot of training and really having a hard time walking. But the other thing I noticed, not doing it in my Achilles, but just doing the normal sub-Q injections in the abdomen, is old injuries. Like I had an old snowboarding shoulder injury that, I didn't even really notice, but I didn't have full range of motion. When I would go up to to pay for like a parking ticket and you have to reach up out of your window, I would have to like support my arm. But after a month of doing that, I haven't had to do that anymore. It was amazing. I wasn't even looking for that benefit. The other thing they noticed with BPC 157 is with a lot of these athletes, the main side effect is a lot of their gut issues were improving. And so one thing that we've learned about that over the years is that BPC helps to repair that gut barrier. And so this can be a really great one. I use it a lot in practice after I've done some sort of antimicrobial protocol as a follow-up to that. How am I going to heal up that gut to make sure these infections I just treated don't come back? And that's where that one can be fantastic. TA1 or thymosin alpha 1. I think of this as an immune reset button. So this removes the camouflage of the system of these toxic cells. So our immune system can actually identify that they're even toxic cells and damaged cells in the first place and help to clean them up. It boosts the thymus gland. It helps reduce inflammation. Really what I see is if someone is so reactive, they're getting sick all the time. It feels like they always have some sort of vague viral something every month or every couple of weeks and aren't pulling out of it. The TA1 can be really great to calm that down, but boost their defenses. So they're less inflamed, less reactive, and getting sick less often. KPV is a lysine proline valine tripeptide. So KPV, not available right now legally in the US other than in oral preparations. And I actually find that oral is the way I like to go with this anyways. Good for mast cell reactions. So especially like food allergies, people with actual mast cell, like they tend to get the histamine, rashy sort of responses. KPV is a little unpredictable, and I'll get into this in a bit, but it decreases inflammation and mast cell responses, can be really fantastic for eczema, especially, or inflammatory bowel disease. I typically do a combination of KPV and BPC 157 together for 3 to 6 months. But I start slow with KPV and really watch, and it's not great for everyone. For some, it's amazing. They feel great. And for others, it can be a little triggering. So it just means it's not quite the right time. Sometimes as we're signaling, right, for the immune system to do something, it can go a little bit haywire. So just have caution with that and introduce one thing at a time. The other one that I'll talk about is TB4 or thymosin beta 4. A lot of times if you're ordering this, it's called TB500. Think of this with chronic injuries, like ligaments, scar tissue, especially to help clean that up. It helps collagen line up appropriately. So I would think of this with some of our Ehlers-Danlos patients. Good for those chronic injuries or those people who are just like tight and stiff and needing some repair. So cell senescence, it is something that's talked about, and why I'm even going to mention this, because man, you'll go to some of these lectures and there'll be hours and hours on what is cell senescence. So it really applies to the two peptides, the TB4 and the TA1. So cells are aging, but they're not dying. So they're getting this DNA damage as a result of oxidative stress and other toxins in our environment. And what happens is sometimes our body doesn't recognize that and is not cleaning them up. And then they're excreting these chemokines and these cytokines. So basically these signals to the other cells around them that's then damaging them. And so it seems to just like self-propagate, right? So we've had an initial insult, maybe we have a gut injury or we got some stupid infection, some parasite or whatever it is. And then it's like, oh my gosh, you're just going down this rabbit hole. We see that a lot with this post-COVID thing, right? So it's kind of activated some cells and then it seems to compound upon itself. And then mitochondrial dysfunction, which is a result of oxidative distress and stress in our environment. These healthy cells aren't using their mitochondria well. And then they're using up fatty acids. They're burning up our resources for that. They're shifting us away from a healthier process. And so what's resulting in that is a lot of this chronic fatigue and this lack of stamina because our mitochondria stop working like they should. We're going for the easy, fast route, but we're doing that at the expense of depleting our resources. And so a lot of you might notice with your patients or with yourself that, you'll be doing okay and then you'll push it, right? You go to the store and you do some errands or you go for a little bit longer walk or push that hill and then you are wiped out for a few days. That's usually mitochondrial issues. And so we're needing to shift out of this this phase to help clean up these cells, but also needing to replenish those resources for mitochondrial support. So what happens to these senescent cells? They become dysfunctional, they accumulate damaged mitochondria, they're displaying increased levels of reactive oxygen species. These cells are using up NAD. So a lot of you have heard about using NAD, like either an oral supplement or even little injections to give you some instant energy. Well, these dysfunctional cells are what's using that up, and it's shifting from oxidative phosphorylation to glycolysis at the expense of using up more NAD. They start to poison the cells around them. They're making, like I said, these signals, these chemokines, these cytokines, these proteases that are impacting all the cells around them. And then it's the start of inflammation, disease, aging. I mean, anti-aging medicine is all how do we get out of this? And even cancer is part of what happens. So treatments for this, fasting, that's the whole push with intermittent fasting or doing some prolonged fast, is it helps to pull you out of cell senescence, helps the body recognize that and clean things up. Exercise can be really helpful. Peptides, especially TA1 and TB4, can help with that. And I'll get into that a little bit. And then ozone therapy can actually help with that. So some of our senolytic peptides are the things to help with this cell senescence. The two I'll talk about are TA1 and TB4. So TA1 or thymosin alpha-1 reduces the ability of those unhealthy cells to camouflage themselves or hide themselves from the immune system. So removes that hidden cloak, right? So our immune system can take care of itself because, ultimately our immune system is better than any medicine that we can take. Our whole goal is how do we get back to our body doing what it knows how to do. TB4 is going to go after NF-kappa B and improves autophagy, so that programs cell death. So it's going to help then kill off those cells and clean them up. So TA1 helps to produce anti-inflammatory cytokines, modulates cytokines, so inflammatory expression, increases viral and tumor antigenic expression, and boosts NK cells and stimulates T cell differentiation, boosts our immune system, especially so we're stop getting sick every month with some other stupid kind of vague viral illness, increases T cell production and antibody production. It's made by the thymus gland. And when it's dropped, that's where we see fatigue, these low CD4, CD8 counts. TA1 is a go-to for someone who seems reactive to everything because it helps to calm things down. And sometimes higher doses are actually a little bit better than the lower doses and just like making things chill out. And it's going to promote cellular senescence. So TA1, my first go-to in chronic patients, really useful for chronic Epstein-Barr, Lyme, cancer, autoimmune conditions, acute things like cold and flu, and vaccine. You can give it along with a vaccine to help with better tolerance, or if someone had a suspected vaccine reaction, you can do a course of TA1 to calm that down. You can use it very similar to Tamiflu for an acute flu or viral illness. It inhibits pro-inflammatory cytokines, helps your cells recognize viruses, so it removes that camouflage so our immune system can deal with it, and it increases T cell production to help you fight infection. Here's just a little bit more on that and some references for those of you who want that. And just a better visual just to see the things we just talked about. But it can help with learning and memory, definitely anti-inflammatory, supporting the immune function while calming it down. And then I have a slide here on dosing, and I have this on all of the peptides, so you'll have them for reference. So think immune boosting and regulating. So for an acute flare or illness, you're better to go in a little bit high. So if you're doing these injectables, it's usually a 0.3 daily for maybe 2 weeks, and then you can back off. Once symptoms calm down, you can back off to 0.15 ml. So we're talking little teeny tiny syringe, very comfortable. The one thing I've noticed is maybe every few injections can be a little bit itchy after. It's not an allergic reaction. It's just, I'm not sure what it is, but it's like not every injection can do that, but every once in a while, can be a little itchy and it'll go away. You can stay on this long-term, incredibly safe, incredibly reparative. And for someone who's been dealing with an autoimmune illness, this is very inexpensive in the end and very safe, compared to other like immune suppressants that we're looking at doing to calm down those reactions, right? Which is setting you up for all kinds of other problems. This really isn't. So you can stay on it long-term. What I've done with some people, because we had a shortage, or not a shortage, we weren't able to get it. There was an FDA ban a few years ago at the beginning of COVID because people were making claims that it was helping with COVID infections, which it was. But there had been a ban, and we weren't able to get the injectables from our compounding pharmacies for quite some time. And just in December, so the exciting news, and just in December, they overturned that because there hadn't been any negatives with this, and they realized that they pulled that from our formularies way too soon. So it's available again in the US. There are online websites from Europe for getting this for research purposes. A few that I have used, that I'm very comfortable using, Prime Peptides is a good one for that one, or Limitless Life nootropics. I feel pretty comfortable with. Just be safe as a practitioner. I would stick to a compounding pharmacy. And now that we have access at the compounding pharmacies again, we know what we're getting, right? Because these peptides are not that stable, right? They're not even a full protein yet. So they're just like a amino acid sequence. And if you vary that a little bit, who knows what the impact is going to be and what the signal is. So you do want to know that this is a trustworthy source that you're using. You don't want to muck around with this too much. So for chronic illnesses, you can do these lower doses, 0.15 daily, or excuse me, what I've done with some people when it wasn't available is because it came as a powder that you would reconstitute. So we knew it was stable for a few years, is I would just have them go through a vial, which would last about 10 to 20 days. They would go through a vial just when they would have a flare until things calmed down, and then they'd take a break and then not make another vial until they needed it. So for a few people, they just needed it a couple times a year. Usually fall tends to be a tricky time for people, or spring allergy time. So this one's fine. I haven't seen any rebounds either way. Kind of depends on the patient. And then non-injection, there are oral products. I've used a product from Integrative Peptides, which is their Thymogen Alpha. It's a little bit different variation of the TA1. They make capsules. I usually find 2 capsules once a day, or maybe 2 twice a day has been my go-to. I do like the injectables better. The other option is you can make a nasal spray from the injectable, or have your compounding pharmacies, now that we can get those again, do the nasal. And so usually I do a dilution that's basically like it's twice as dilute as the injectable. So you just kind of double the amount of saline that you're using in there or sterile water that you're using in there. And then you can just use that as a spray in the nose once a day. So that one has worked pretty darn well. I like the injections best. I feel like they're the most predictable, but the nasal sprays have been a really good option for some of our kids that we don't want to inject. Okay, TB4 or thymosin beta 4, also sold as TB500, is a powerhouse for healing and recovery, reduces scar tissue, soft tissue repair, fights inflammation, supports brain and muscle health. It's even thought that it has some antimicrobial properties and very protective for the brain. This is a good one. Difference with this, so it's good for wound repair. Sometimes they will alternate this or use this in addition to the TA1, but unlike TA1 that you can safely use long term, this is the one that also increases that collagen deposition. So really good for people like with that ligament laxity, Ehlers-Danlos type thing. But you have to cycle it. So here's again some resources for you for later. But dosing is a little bit different than what we've noticed here with TA1. But the bigger thing is you don't want to go longer than 3 months at a time. So you have to cycle maybe 3 months on, 1 month off if you're having some really nice gains with this and wanting to use it longer. I like TB4 or TB500 quite a bit with post-COVID reactions. So a lot of times what we're seeing with COVID is the first 10 days are really more the active, you need antivirals, things like your Bicol skull cap and your lysine and your Melissa and some of those things. But around that 10-day mark, people are either getting better or they go into this next phase, which is very inflammatory. So at that point, you're not really needing your antivirals. You're needing things for the inflammation, and the TB4 can be really good. I've had really good luck. There's an oral product that Integrative Peptides makes. They make either a spray or capsules, and that's where I've seen that one in particular being a shining star, that I will use that pretty heavy for maybe 2 to 8 weeks, depending on how severe someone's symptoms are. But that one's been really good there. But again, you don't want to go longer than 3 months. This one's not available right now in the US as an injectable unless it's for research purposes that you're ordering on your own. But you've got all your sources here for ordering, or not for ordering, but for dosing. So BPC 157, one of my favorites, really great for healing up old injuries and preventing new ones. So I would say for any of you trying to be active again, either after a phase of being sedentary or maybe you're over 40 and you're like, oh my God, my body just doesn't heal up like it used to. This one is your really great friend and very safe to use long term. So game changer for those old injuries. And then, like I said, that side effect they found is healing up the gut. So really great for gut repair as well. The one hint I would give you is BPC can be a little upregulating in our chronic patients because it is, turning on that immune system function for repair. And sometimes if there's still a problem going on, like if there's still a microbial infection going on in that gut, or if there's still an active Lyme process going on that hasn't been treated yet with antimicrobials, what I will find is you'll start BPC 157 and someone feels worse. And if that's the case, it doesn't mean they throw the peptide away. It doesn't mean you made the wrong choice. It just means it's the wrong time. So there's something you still need to address and then come back to this when the body can go into more of a repair phase. But it just tells me you've got more work to do to get that microbial load down. Twice daily dosing is usually best with BPC because it has a half-life of about 12 hours. So unlike the others that are once a day dosing, BPC can be better. So if you're going after an acute injury or you're really trying to heal that gut, I would dose it twice a day. So BPC 157, really great for traumatic brain injury. So someone gets a concussion, they're in my office, they're doing a BPC 157 spray or the injections, but I like the spray. They're doing the spray twice a day. And I have seen, I've had some direct patient feedback now on at least 5 people who were having post-concussion symptoms of really like that nervous system overwhelm, not tracking right, word finding issues, light sensitivity, that it was changing things sometimes within a couple days. And I've even had some of my teens ask to stay on this, which tells you that it's doing something because they don't ever ask to stay on anything. So really healing, good to reduce inflammation, brain protection. Think of this for that concussion. Get on it as soon as you possibly can. So dosing for this, for injections, I put here, it is legal again. So just like TA1, all of a sudden FDA has released that ban. And so we can get it at our compounding pharmacies again, which is great. So the thing I had really struggled with that is I was getting injectables, but I really missed my compounded creams for topical use. And gosh, they even put BPC in some face creams along with some copper peptides, which is really nice again for repair. So it can be good for healing up, those darn wrinkles and just damaged skin from the sun. So injections we can get again at our compounding pharmacies here in the US. Same thing, you can use those same sites to order for research purposes out of the country. Acute injuries, you want to sometimes go a little bit higher, and you tend to inject around the injury, like you want to flank that area. So instead of doing a 0.15 per little sub-Q, which is like I've taught patients how to do their own, right? It's just a little pinch and you go in the soft tissue. You're not going to hurt anything. You can use a freezing spray if you need to. Like when I did my Achilles, I definitely used a freezing spray and I just pinched the little bit of tissue I could. I didn't go actually into the Achilles tendon. You don't have to, you're not going into the joint. You're not going into the tissue. You're just going into that subcutaneous tissue, which is that like basically that little fatty layer that you can find anywhere in the body. So for an acute injury though, sometimes we're doing a 0.5 ml twice a day, just for a couple days, flanked around that injury rather than just doing a, like in the tummy or the arm where it'll just go to that distress signal. Let's put it close and get as much repair as possible. But you don't have to inject that injury site to get benefit. Like I said, when I was just doing my little pinch in the stomach, I found that shoulder healed up after a month, and that really wasn't even my intention. And that had been a long-standing issue. Oral is really effective, and I tend to use oral dosing if I'm going for gut because I want it to make more direct contact with the tissue that I'm trying to heal first. So the oral products can be really good. Like I said, half-life is about 12 hours, so twice a day dosing is best. Oral capsules, you'll do 250 to 500 milligrams twice a day. For inflammatory bowel, you might do a loading dose of 1,500 milligrams a day for 4 weeks and then back off to maintenance. And I do find about a 3-month window is the sweet spot to really get some repair. I think in long-standing inflammatory bowel, you got to make sure those microbes are under control. So if you flare someone, again, think about, okay, I haven't killed something off. Let's do a stool test. Let's figure out what's going on there. But you might need a little bit longer. And then some other routes that you can do. There is a spray, like I said, that I really like for concussion or anything when we're trying to go for the brain. And it's a lot easier than injections for a lot of people to do. So that one is usually 2 sprays twice a day for several months. For the concussion, sometimes I'm finding people are needing that for about 6 months, and then they may have to go back to it if they have a re-injury, which can happen. Like I had a young kid, a teenager in my practice, had a head injury. We probably did 3 to 6 months of that, had been doing better, and then he went skiing again and chinned himself, right? So it re-injured some things, and we're just doing another short course. I'll probably just do a month just to get things back on track. And then the topicals can be really great. I usually do a 2 milligram per mil. So if someone's afraid of injecting, they don't work as well as the injections, but it can be good if you're trying to cover a broad area or a tender area. Like I used the cream on my Achilles after I was out of that acute, horrible, couldn't put my heel on the ground and had committed to doing that long run sort of phase, just to help heal it up, because it took a couple months until it was stopped being so cranky, and I haven't had issues with it since then. So that's the advantage of the peptides, right? Is that it's repair. It's not just a Band-Aid, it's actually signaling for repair. KPV, I talked about a little bit. So this is that one for acute and chronic inflammation, especially if it's mast cell related. Think of this, if you're thinking mast cells, you're thinking histamine. So you're thinking immune-mediated skin and gut issues. You're thinking the eczema. You're thinking the person who gets a little Hy-Vee rashy with things. A little unpredictable. And right now in the US, I only know of oral products. If some of you know of others, please, find me on Instagram and send me a message, or message my office. My email's at the end of this, or at least you can call my office. So this supports healthy immune balance in the mast cell system, good for acute or chronic issues. It's found in alpha melanocyte stimulating hormone. It can decrease inflammation and mast cell responses. Like I said, though, it's a little unpredictable. So it's either amazing or it is weird. And if it's weird, come back to it. Like, you've still got another problem you got to deal with and then come back to it. So dosing, so with this, think inflammatory, think bowel disease. It definitely can be a little triggering for some. I would tend to start, if that person got triggered, let's say you started with this, I would back up and then do TA1 first for a course and then maybe revisit this or use the two together. This one combines really well with BPC for inflammatory bowel and eczema. I put the oral dosing on here, so it's 250 to 500 twice a day for about 3 months. You're not going to start with that. I would highly suggest that you start slow and work your way up to that. See how your body is going to behave with it first, and then find your own sweet spot for dosing. Not everyone is the same. There is a spray available from Integrative Peptides that I've liked. Sometimes that can be good if your mast cell issues are more like triggering you being a little upregulated and overexcited and stimulated rather than kind of the classic histamine sort of rashy type thing. But if you're just like, oh, you eat things and you feel like your heart rate goes up and you just feel like mean, then the spray might be a better option for you. And this one is banned in the US for injections due to a lack of human clinical trials. So hopefully it'll be available again soon. Who knows with all the political changes, hopefully some of this fun stuff we like will become available again. But you can get it for research purposes. But I do like the oral product, which is what I still tend to do. The last thing I'll talk about is low-dose naltrexone. Not a peptide, but it's an off-label use of a prescription item. I tend to get this compounded. If someone's really on a budget, we can do some dilutions of the regular pharmacy item. Kind of one note with that, if you're a physician, be careful about prescribing this. I have had someone denied life insurance because they had a prescription for naltrexone because it is used as an opiate antagonist. So it's used for some people to get off opiate addiction because it'll make you violently sick if you have an opiate. And so it was, even though it was clear in their record, we were using it for something different. It was really interesting to see that she had been denied life insurance for that reason. So I am hesitant to use the full dose prescription, even if I'm having them dilute it. I tend to use the compounds and I haven't seen issues with that. It is available as a compounded capsule or as a topical cream. And gosh, in the autism world, they were using naltrexone. Gosh, when I first started with Defeat Autism Now, which was, it doesn't exist anymore, but back in 2005, 2006, it was a really cutting edge forum of doctors getting together, sharing new research, sharing new clinical findings. Parents were included in this. So it was like this really great merge of that. But they were using a ton of low-dose naltrexone as a topical with kids and really finding that it was reducing reactions, helping with sleep quality. I find it's kind of like a TA1, different effect of how it does it, but it can help to reset that autoimmune type presentation. So if someone's overly inflamed, overly reactive, low-dose naltrexone can be great. Really fantastic with inflammatory bowel or any chronic, inflammatory driven issue. I use this with almost all of my classic autoimmune patients unless they're on some other type of immune suppressant. But the thing I like with naltrexone is it also boosts NK cell function, so helps our immune system work. So rather than a steroid that's just suppressive, this is, again, kind of like TA1 where it calms things down, but also boosts our ability to fight things. Low-dose naltrexone, there are thousands of books out there, thousands of research articles. I listed a few of my favorite websites. The ldnscience.org is really great if you're looking for specific conditions and trying to find some articles related to that to back you up. The lowdosenaltrexone.org is good that you can put in different conditions and get more patient feedback of what are they finding with dosing. Typically, we suggest that you dose this at night, but for some, because it can help with sleep, but for others, it's been really stimulating. And so they might have to move it to morning. And I find that website based on condition often can give you some hints for like, oh, with this particular condition, we're typically finding maybe the cream is better or morning time dosing is better. What's been interesting since COVID as I'm seeing more inflammation, I'm having to go down on my doses of low-dose naltrexone. I don't know if other people have seen that as well. But I used to start pretty quickly at the 4.5 milligrams or even go up to 9 milligrams. But what I'm finding now is we're having to go quite a bit lower, especially with our adults. Our kids aren't much different. Our kids can often handle more than the adults can. So dosing anywhere from 0.25 to 4.5 milligrams a day. I usually don't increase doses more than every 4 weeks because what's off with this one can be sleep. Either it can make you incredibly tired or it makes you have these very deep, vivid dreams, not scary dreams, but just this weird, like you're riding a rainbow on a big wheel sort of dreams. That can happen for a few days and then it normalizes. And some people really find it helps them get in a nice, deep quality of sleep. And other people are finding like, it's just making them feel a little groggy all the time, or for some, a little overstimulated. So you're better to err on the side of starting low and working your way up and finding the right dose for that patient. Right dose usually ends up anywhere in that dosing range. Like I said, 0.25 to 4.5. I would say most common in my practice is somewhere between 1 and 3 milligrams. Topical dosing is the same as the oral dosing. With my kiddos, usually we're just dosing it at night. We haven't had to dose that in the morning. I haven't seen any skin reactions with that, and I do see it working. I tend to have parents apply it to the upper back. Seems to work really well. So it works as an immune modulator, reduces autoimmunity and inflammation, helps with energy, helps with sleep quality, boosts NK cell function to help that immune system work better, reduces pain. This is a big one, right? So naltrexone, as long as you're not on opiate, right? Because it'll make you really sick. So as long as you're not on an opiate pain med, this can help reduce your pain, which is huge, right? There's so few things that can really touch that. Let's see, benefits. I've already talked about this, but it can help your energy and improve your sleep quality and help your brain work a little bit better. I think I talked about all of this a little premature. Yeah, so if someone's more sensitive in general, I match dosing with someone's personality, right? So if someone's hesitant, they really want to think about things, we're going to start low. But if they're like, oh, I'd like to do it, let's go, we might start with the bigger doses and start to layer things in pretty quick. I just find that tends to match up. Some warnings on this one. It can make you more sensitive to alcohol. So one thing I've noticed when people are on naltrexone is all of a sudden they get drunk faster than normal and they weren't expecting that. So if you haven't warned them, they might get into a little bit of trouble with that one. And, the first time they go to a party after they've been on it, or they might be incredibly hungover and you're not their best friend with that one. And again, it interferes with opiate pain meds. So if they're going into surgery, I want them to communicate with the surgeon, find out in advance, like, are there going to be a possibility that opiate pain meds are going to be used? And if so, we will take a break before surgery so we don't interfere with that. And we make sure the pain meds are completely done and out of their system before we would go back on this. So thank you very much. My first webinar recording that I've done on my own, so I hope it's not too clunky and I will get better over time, promise. I've done a lot of recordings that other people have done for other conferences and things, but this is the first time we're doing it on our own. But it was just information I wanted to share. And my goal as I move forward is to share more and more information with both practitioners and other patients, just so I can empower you to do more for your own health. So you can find me at holistichealingarts.org. You can find me on Instagram. I'm actually finally on social media. So at Dr. Amy Derksen, trying to post all the time and share all kinds of tidbits of info. So hope to see you there. Thanks.